So I have the dreaded post-lunch spot, and it's the second day, the home stretch of the conference, so hopefully you guys will stay awake. Thank you for sticking around. This is not a high-level talk, so you can sit back and relax for the next 20 minutes and hopefully just learn something about our SBIA program, which is what I'm going to talk to you about today. So the objective of this presentation, hopefully by the end of this talk, you will be able to describe the resources that we provide via SBIA, and you'll be able to take advantage of everything that we offer. So just so I can get a show of hands, I know from our registration, I know our numbers, but in this room, how many of you, I guess, are defined as a small business? So less than 500 employees, including affiliates. Oh, wow, so it's a lot. Okay. And how many of you, prior to this conference, have interacted with SBIA in some way, attended a conference, webinars, called, emailed us? So not many of you. And that's always, it always amazes me every year. We put this on, we've been in existence for, 8 years now or so. And, we do the same things every year. We keep adding on, and there's always new people at our conferences. So we must be doing something right to be attracting new small businesses. So, and I know you've heard this through the different subject matter experts that have spoken, and Brenda alluded to it as well. But a lot of companies, I feel a lot of representatives are scared to contact FDA when you have questions, almost like you're going to be blacklisted or something, which is not true. And I used to work for industry, so I know how it is. But, in reality, FDA encourages frequent and timely interactions with sponsors. It's a win-win situation. So our philosophy is really that timely interactive communication, enhances drug development and facilitates the conduct of efficient drug development and review, and ultimately enhances public health. So we want your questions. We want to be able to help you. We want to decrease those first cycle reviews, help the review divisions. So it not only helps you, it helps us. And FDA recognizes, we really feel that these innovative ideas do begin with small business. For this reason, FDA has created small business offices in many of these different centers. Within CDER, it's us, SBIA. Within devices, it's DICE, they're next door. So a lot of these centers have these offices to reach out to help industry. And I think we do a lot. Our program was really bare bones when we acquired it back in 2009, and Brenda has really built it up to what it is today. We recognize the challenges that small businesses are faced with, not only in navigating through the regulations, navigating through our website, which can be challenging in itself, but we know that with small businesses, you don't have an entire group dedicated to regulatory or to filing or to labeling review. It's really one or two people that are wearing multiple hats. So we know you have those challenges, the expertise and data that are needed in developing a drug and filing is so immense, and you need that guidance, and that's what we're here for. We also know that there's very little room for error, and that can be frustrating because small businesses especially, you don't have that wiggle room for cost and time. You're very crunched on all that, So we're here to help you and provide that technical assistance and get you to where you're going. We're kind of like the first stop within the agency. When you don't know where to go, you contact us. Just so you know where we're located within our giant agency, so within CDER, there's many different offices. We are within the Office of Communications. And within that is our Division of Drug Information, and we're a group of people under DDI, our Division of Drug Information. Our audience, so, we used to be called CDER Small Business for the longest time because that was really our focus, but we realize we're really helping everyone. There's no qualifiers to come to us for help. I use that definition of 500 employees, including affiliates. That is, a definition of small business, but not for SBIA. We help large pharma. We help consultants, whoever comes to us, we help them. Everybody's welcome to attend our conferences, to contact us. So that's changed throughout the years. Just so you can see who we do help, some of our stats show that a little over 50% of the companies that we provide services to and that utilize our services do fall into that small business definition. And about 50% have never submitted an application to the FDA, so they're very early on in the process. And we're global. As you know, Jeff has flashed up that geomap many times. This is from last year's conference. So as you can see, we have, a worldwide presence thanks to technology. And, we really reach out to these people. Last year alone, thanks to technology and online conferences and email, we reached out to our conferences in total throughout the entire year. We had over 17,000 registrants in over 75 countries. So it's, it's a big deal, and we're very proud of it to reach out to all of you all over the world. And not only do we, our conferences, not only does that show how international we are, but we also reach out to help people. So we have been translating webinars into the Chinese language. We realize that there's a lot of inquiries helping, and we have a great deal of audience in India. So we are working with the Indian branch of FDA to answer questions and field questions. So there's a lot we're doing to kind of reach out to different parts of the world as well. This is just a brief nutshell. I'm going to go through everything we do, but this is just an overview of the types of services we provide, both outreach. We also respond to inquiries. But instead of talking, it's movie time. I'm going to show you a short 90-second video. So, Mitchell?
The journey to develop and market a human drug can be long, complex, and filled with regulations. But FDA CDER Small Business and Industry Assistance, or SBIA, is here to help. SBIA provides education and answers to help all regulated pharmaceutical industries, not just small business, all over the world. What do we offer? Web resources for all your questions and training needs. The popular regulatory education for industry, or REdI conferences. Free events that offer direct interaction with FDA subject matter experts and provides RAC credits. We offer free webinars to share FDA's knowledge and expertise, featuring live question and answer sessions, video and audio archives, and virtual attendance from anywhere in the world. We publish the CDER SBIA Chronicles, a brief e-newsletter and podcast that highlight a specific and timely regulatory topic. And we offer in-depth CDER Learn, web-based learning tutorials. Stay current by signing up for our listserv, or connect via LinkedIn. And best of all, everything is free.
So you can see we do a lot. We have a lot of outreach, and we really try. We want to hear from you. If you guys have suggestions on what you want to see from us, additional topics, additional programs, we're always, that's how we grow our program. We're just receptive to feedback. Okay. So I'm going to go through each of those things that we do in a little more detail. Next time you can take advantage of it and you can learn how to sign up for these things. So in addition to all the outreach, like I said, we respond to phone calls and emails. We have a team of healthcare professionals, and that's what we do all day long. We get anywhere from like 70 to 100 emails a day, not just from industry, but many of the emails are from industry. We also answer phone calls. So in last year alone, we answered over 3,600 emails and almost 6,000 phone calls. And in total, over 9,700 messages. So, there's no qualifier to contact us. You can contact us, you can email us with your questions. We are live people on the other end of the phone and on the email, even though we work for the government. So we try to get back to you within 48 hours, even if it is we need to consult the subject matter experts, which many times we do because we get the answers from them. So, but you will always hear back from us. How many of you have ever emailed us? I know I've recognize some of your names. I've been looking at your name tag. Okay. In addition to email, you know we have these workshops and conferences. You're here today. So the REdI conference that you're at today, it used to be, it's a hybrid conference, as you know, devices and drugs, and we used to hold it twice a year. So for the spring conference, we always kind of examine our registrants, you know, the people that are registered with FDA and the companies, and we travel throughout the U.S., so we rotate, and we go to those hot spots where there's a lot of people, small businesses, small device businesses, small drug businesses, and we go there. We used to have it twice a year. We used to have, because it wasn't hybrid, it wasn't online, so we also used to have a similar conference in the fall in Maryland. We no longer have that because everyone can dial in, so we're still continuing to tour the country in the spring. We also offer many other conferences, and this has grown tremendously. REdI used to be the only conference we offered, and now this year we intend to hold 8 conferences. This is our second. We held the Generic Drugs Forum in Maryland in April. We've got the Complex Generic Drug Development Workshop coming up in September. We hope to host another CITSI or Clinical Investigator Training course probably in November. And these are mostly in Maryland. This is really the only one that we tour for. But everything, we try to keep them free, and we try to keep them online as well. But there are some others. So in September, it's not finalized, but we hope to have an OPQ, Office of Pharmaceutical Quality Biopharmaceutics workshop as well. And there are some more that we're working on. So, you know, you can go to our website and stay tuned. We have a calendar, and you can register there. So, you know, we've got a lot of activities coming up, and everything is archived. All the slides and the webcast, everything is archived on our website, so it's always accessible. And for those of you who want to know, those should be up within about a week, 10 days at the most. Webinars. Anyone ever dialed into a webinar here for SBIA? Okay. Well, the others of you that have not, I highly urge you to. They're almost like mini conferences, some of these. They're 4 to 8 hours in length, and it's not just one speaker speaking, but, you know, sorry, 1 to 8 hours. Some of the extended ones are 4 to 8 hours, and it's just like a panel of people that are speaking back to back. So it's almost like a mini conference. We have Q&A sessions, so the same way the people online are asking their questions in the pods, you can do that, interact with the subject matter experts. These, again, are also archived on our website. And they're just, it's a different tool to communicate with industry. So far this year, we've had 3. I believe the FDA My Studies app. We also had the Framework for the Real-World Evidence Program and Risk-Based Approach to Monitoring Clinical Investigations. And again, those are archived, so you can go back and view them. The only thing is you won't have that live Q&A session. We have 3 upcoming in June next month, and Ray mentioned these yesterday, I believe. June 3rd, we've got one on financial incentives. So we're going to be covering the exclusivity board, priority review vouchers, waivers, BSUFA, PDUFA. It's going to be a great 5-hour webinar with lots of speakers. So you can go on our website and register for that. June 13th, we've got about 1.5 hours on identification of medical product initiatives. And then June 17th, it's a 4-hour webinar on the FDA perspective of bioanalytical method validation. And you can sign up for these again on our website. The SBIA Chronicles, I write these. I work with different subject matter experts, and we try to publish about 6 a year. Just highlighting different topics. You know, we have so many guidances that have come out in the past year. And not only that, just regulatory initiatives, modernizing clinical trials. There's so much going on at FDA. And, you know, sometimes it's overwhelming. Even like a guidance document, if we have a 20-page guidance document, you put it in your inbox, flag it. I'm going to read this. I'm going to read this. You never get to it until you really need it. So these are just quick 1- or 2-page summaries. They're also audio podcasts. You can listen to them on your way to work. We just want to get that information out there however we can. So this is another means by which we do this. 2 recent articles. We wrote one on master protocols and modernizing clinical trials. Just put one out last week on competitive generic therapies, and I'm working on one for submission of research INDs. Presentation. So we go out and present any chance we get. Every year we go to the annual the HHS annual Small Business Innovation Research, Small Business Technology Transfer Conference, where we speak about our program. We talk about new drug development. These are very, very early stage companies. We also have one-on-ones with them, so they can sign up to speak to us, and we can answer their questions. So that's always a great conference we go to that we enjoy going to. We participate in the National Institutes of Health Commercial Accelerator Program. So these are also very small companies, early stage, that apply for this program. If they get accepted, they're able to present to us and to different investors, and we provide feedback. We also take presentation requests. So last year, someone emailed us from the University of South Dakota, and we went out to speak this year at their Quibit conference. So, you know, if we have the time and the resources, we try to accommodate you because we want people to know about us and the resources that FDA offers. We exhibit as much as we can, again, to increase our visibility and our outreach. CDER Learn. Quickly, these are online tutorials, online courses that we have developed, different topics, OTC drug development, CMC perspective of the IND, electronic common technical document, engaging with the FDA. We've got one on drug registration and listing, and then we've got some on GDUFA for generics. So these, again, you sit down, you can take the courses, they're free of charge, it's just educational. And these are all on our website as well, and I will show you where. Small Biz Buzz, how many of you subscribe to our email updates? Okay, so we try to push information out as much as we can, hopefully not too much. I really don't like pushing out too many messages, but we're on the other end of that. So anytime there's new regulations, new guidances, new Federal Register notices, new meetings, webinars, this is what you want to sign up for. Our website has changed a little, so if you go to our website and scroll all the way to the bottom, all you have to do now is type in your email address, click subscribe, and it should be subscribed. This is very new, so hopefully it works. Another way we push information out is social media. So, you know, we have a big presence on LinkedIn. All those things I described, we push it out in social media. So when you're browsing your LinkedIn, you'll see it in your feed. If you subscribe, again, on our website, click on follow us. We also sometimes do Twitter chats during our meetings. We post things on our FDA Twitter page and Facebook page. So we really try to get out there. These are our websites. If any of you have been on the website in the past month, you'll notice that it's been revamped, streamlined, the FDA website. We originally created this as kind of a portal for industry to come and get whatever you need. So as you can see on the left, that's our CDER SBIA website. And we've got a calendar on top. So if you click on one of those links, you'll get to, if you want to register for a webinar or a conference, you click on that, it'll take you to the page where you can register. Down below, we have a drop-down menu. If you want information on, I don't know, on clinical trial, drug development clinical trial, you would click on drug development, and then there's a drop-down menu there. So we've tried to make it very easy for industry to find what they need, because it's often, you know, sometimes Google is your best friend with the search engine. So we've tried to make it easy. On the third link on the left, there's a column. If you click on the third link, you'll get to CDER SBIA Learn, which is the website on the right. And that is our multimedia resources. So all of the archives are on that website of our webcasts, our newsletters, courses, everything, and they're arranged by topic. Quick challenge question: how can one stay in the know about upcoming SBIA events, webinars, and news? Sign up for our email updates, bookmark our website, continually check the calendar, follow the SBIA LinkedIn page, and see all of the above. This is our contact information. I believe we have business cards out there, so please contact us. That's what we're here for. You won't be on any kind of a list. We don't keep track of how many times you contact us. So we're just here to help you. That's why we exist. Oh, and one more thing, quickly, before I forget. You know, it really means a lot to us when we see how much of an impact we have on you. So please provide us with your feedback. And we really like seeing the numbers. So, you know, we realized that we ran some numbers and realized that if 1 hour of SBIA training is worth $100, in the past 8 years, we have provided over $27 million worth of training. So again, for those of you that are new, tell your colleagues we want to reach out to more people. Thank you.